To get into this conversation this hour, it is Friday. So a healthy Friday conversation this morning is with is rather around an issue that, like I said earlier, we do every day. We hope, and if you don't, Dr. will tell us today then that is an absolute problem. Today we're looking around the issues of having a healthy bowel, and maybe Dr. will tell us the difference between some of these organs and what it is that they're supposed to do. But Dr. Christopher Opio is a consultant gastroenterologist with the Aga Khan University Hospital. We're looking into optimizing bowel health, proper posture and nutrition. Dr. Opio, good morning.
Good morning.
Welcome to the Situation Room.
You're welcome too.
And we are looking into an issue this morning. And as we do that, before we do that, let's give you some work. And before we're talking and chatting, you say you're always on call. Even here now, we give you work. And what that is, though, in this case, is interpreting a proverb that Dennis is going to share with you. He'll tell you where it's from, and we'd love to hear your interpretation of it.
The country is South Africa, whose economy is one of the largest in the continent, and it is a country that has gone through a very difficult history. If you talk about apartheid and what that did to the people of South Africa, and with that we see a nation that is working every day to better itself on a daily basis. It is a country that is rich in minerals and rich culture, their music, I talk about their movies, and just the entrepreneurial stature of the people of South Africa. But let's go to the proverb. You are what you do, not what you say. How would you interpret that?
So you are what you do and not what you say. Mm-hmm. So saying is basically verbal. You can call it gossip. You can call it dressing yourself. Doing is what we see you actually do, and it tells the story of what the person is like. Mm-hmm. So in my opinion, we have had so many people talk about so many things, but at the end of the day, they do the opposite. Mm-hmm. That tells the story of who they are.
Yeah, well said.
Absolutely. All right, so Dr. Pio, as we looking into this, from babies to older people to, everybody across the physiological spectrum, one would hope then has, bowel movements every day. But we also know that this is a problem. But let's start with, first of all, what proper bowel health and nutrition would sound like, and then we go into some of the issues around that and how we can make sure that we're optimizing this.
Oh, so it's rather easy, because the question is, what is the bowel? Mm-hmm. Okay, so basically you can call it the digestive system. It includes from the mouth to the anus, okay, and it includes the esophagus, the stomach, the small intestines, and the large intestines. And of course, you will have supportive organs, the liver and the pancreas. So the question would be, what is optimal? Of course, different people have different bowel habits. It depends on the environment. It depends on what you eat. Mm-hmm. It depends on what your health is like. Because if your health is poor, you may have certain poor bowel habits. If you're on certain medications, you may also have certain poor bowel habits. And the issue is, for example, look at Lake Victoria. There is water in and water out. Mm-hmm. Okay? What happens if there's no water out? The fish probably will die. Okay? All right? So it's important that you have to have an entrance and an exit. Mm. And there are so many factors that may affect that. So in the human being, it's similar. So if we don't have a proper exit, then there's an issue. Again, back to Lake Victoria, if you don't have, say, rivers feeding into it, the rivers feed with probably silt and certain nutrients, the fish are not going to thrive and so forth. If you have a blockage somewhere, or if you have, say, the water hyacinth affecting the lake, what happens? the ecosystem is
Destroyed.
It's destroyed.
Yes. So the bowel is an important ecosystem. It consists of, I would say, basically a compartment that enables you to take in nutrients. That includes water, foods, micronutrients, etc., and so forth, and also to process them and in such a way that you're able to utilize them. If it so happens that there's a problem there, then you have the whole body having problems. So with that, I hope I've kind of set an introduction. I'm just trying to make it simple.
In terms of what it is?
Yes.
Okay. So, why is it important, this system that you've talked about? Not just digestion, but for overall health. We tend to think, okay, well, so what? You eat, it does its thing. We've learned in science that there is the intestine for absorption, and then there's the other one for the other function. But we also know that beyond digestion, you can look at someone, or that somebody can go through a problem that will be connected directly to the bowel system. Why is that?
So it's good you've used the right terms. In fact, I'm excited by how you have opened it out. So the issue is, let's start with there's the theory about, I'll now go a little bit technical, theory about the gut-brain axis, okay? So the function of the gut is not only for nutrition. Immunity is important, and also brain function is important. And of course, nutrition, it can affect other organs, okay? Say the heart, it can affect the vessels. You've heard of people who have heart disease. It can affect the kidneys if you're dehydrated. Some of these micronutrients are also very important. But I think for most people now, there is the link between the gut and your daily function, okay? It has been shown that a dysfunctional gut can affect your sleep, can affect your performance, can cause depression, okay? There are certain diseases where functional bowel diseases, or we call them functional bowel diseases, where the doctors looked for everything, but they have failed to find. And this individuals may present either with abdominal pain, which may be chronic. They may present with bloating. They may present with constipation. They may present with diarrhea. They may present with all of the above. Then on the extreme side, you may have people who gain weight, okay, and it may cause issues like sleep apnea and so forth. It may affect your usual activities, say your sex life and so forth, or you may wake up in an irritable manner because either you're constipated. So there's a lot of issues. Let's start with babies. When they're constipated, what happens? Have you seen babies? Yeah, they're busy crying, etc., and so forth. Let's go to children. Okay? Some of them, you have noticed some children vomit in the morning because they have not slept properly and so forth. So it's kind of an interaction back and forth between the various organ systems and I would say, the neurological system and other systems. And we all know that mental health is very important. So if you have dysfunctional gut, definitely your mental health is going to be a problem.
So let's talk about the bowel in terms of the quality of what it is we ingest, because it starts from there. So here's a question where, for me to have a good bowel, what are the foods that we keep being told balanced diet, but what exactly is balanced diet? You know, there is the aspect of water. There are those who say just ingest any liquid and you'll be good, because then again, at the end of it, when you're doing your business, it's going to be smooth. So let's just paint a picture of what one would ingest to help with a proper bowel.
Oh, that is even better, because I'm going to give you my heretic thoughts. Yeah. So, which is different. So let's go back to history.
Yeah.
Okay. Your grandparents. Okay, let's say before the Portuguese came, what foods were they eating? We have we profiled that? Okay, what foods did the Portuguese introduce? What is the food that everybody runs for on the street? It is.
Oh, right now?
Yes, even previously, and it's a national food and so
Maize.
forth. So,
Corn. Yeah.
Yes, who introduced it? The Portuguese. Was it here?
No.
No, it was not here. Everybody says it goes for maize. There were other foods.
Yes,
okay.
there were.
Okay.
The roots.
Yes. So, is there a clinical, a clear link between change of diet and increase in bowel,
issues?
Issues.
Yeah.
Yes, there is. It's definitely there. So, you just need to profile how people's diets have changed.
Okay.
Previously, your grandparents never used to see chips and so forth. You now it is standard.
Yeah.
It's easier to go eat this, eat that.
Even
and
the
so forth.
potato itself was
So
not a traditional-
potato in itself is kind of a little bit different because it has a little bit more food quality. But again, the way it is used, in my opinion, is suboptimal. So you asked me what, in my opinion, is a balanced diet.
Yeah.
Half the plate, green leafy vegetables and tropical fruits. You can take the rest of the fruits, but I tell you, apple will not help your bowel move because it was introduced. Watermelon is watermelon. It reduces on your calories. When was watermelon? When did you see a lot of watermelon in this country?
It's not that old, actually.
Yeah.
Yeah. So people are introducing this stuff. Was spinach there before? Now you talk about it as a green leafy vegetable, but I'll tell you. So when you eat spinach and you go to the toilet, what do you see?
Green.
And when you see green, what is it? Spinach. So probably it's not being processed.
It's just come through the way it's gone in.
Yes, and some people will tell you that probably when I eat this stuff, I really feel uncomfortable. But do we know about the traditional vegetables?
Like your kunde.
Yes,
Brenda.
managu, blah, blah, blah. But remember, it's not one size fits all.
Yeah.
Sure.
Yes, so I usually tell individuals that you are the doctor. Choose what you think. Okay, all right. So half the plate, breakfast, lunch, supper, needs to be fruits and vegetables. When you go elsewhere, let's say you guys are rich, you've been to Paris and so forth. When they take you to a fancy restaurant, what is the plate like?
Oh, there's a big plate and there's very little on it.
So those are amounts. Anything else?
A lot of meat.
Lots of cheese.
No. Small piece of meat. Yes, but plenty of
Veg,
and so forth. Of course, for certain places, the fruits are expensive, but the rich people can afford them. So
Yeah.
what the heck? While for us here, we are pushing all the good food to other people and taking up the wrong food.
So I heard you say tropical fruit. So if we look at this neck of the woods, what are the tropical fruits? What are we talking about?
We have
here?
all gone to
Mango,
school now. Yes, that's one.
Yeah.
Mango.
Yes.
Pineapple.
Two.
Papaya.
Excellent.
Yes.
Okay.
How often have you eaten papaya and has it helped you with?
Oh,
All the time.
Yeah.
All the time, yeah.
Those are basic things. Anything else?
Passion.
Yeah.
Maybe not so.
Avocado, excellent. Yes, you're exporting all of it and people are buying it and you're not eating any of it.
Eat it here.
Yes. Anything else?
Oh no.
And even avocado, you use it for your skin, you use it for your hair, you use it for everything.
Put it through.
So so what I tell people is just go to the markets and look at you have dragon fruit, you have jackfruit, things like pumpkin also help you.
Custard apple.
Yeah, custard apple. Those are the things that help. And please don't go and put it in a machine and say it's going to be beneficial. Eat them.
As they are.
Yes. Okay. So
Okay.
remember, half the plate, breakfast, lunch, supper. Now the question is, do we need supper?
Oh my goodness.
Do we need supper?
Yes.
Do we?
Need supper.
No, it's now we're asking you.
No, I'm asking you. Do you need supper?
Okay, so so now can I answer the question with a
Yes.
question back to you?
Yes.
That oftentimes we ask ourselves, the things that you put into your system, it's not just so that you feel full. That food is supposed to be a function. Food is supposed to serve for functions to take place
And
in
pleasure
your body.
also.
Pleasure also. You enjoy the food,
but
but there's a function that
Yes.
the nutrients from the food are supposed to perform in the body.
Yes.
Now, when you go to sleep at night, as one would assume most do at the end of the day,
Yes.
that you're not really needing much, are you? Because you're going to sleep.
Oh, you're going to sleep.
Okay.
So you technically, if you're overweight like me, you don't need it. You have a good breakfast, have a good lunch, okay? And it kind of rhymes with your hormones and so forth. You use that activity. And when you want to go to bed, you want a little bit of an empty stomach and so forth. If you have reflux, it helps you treat your reflux. The only time that people usually need supper, in my opinion, is either children who are growing, or if you have malnutrition or you want to gain weight or something of the sort. So
But
those are
otherwise, at night, drink water and mind your business.
Yeah,
and
mind your
sleep.
business,
And
whichever.
sleep. Okay, so let's look at then actual, because this has been in debate for a very long time, and sometimes the conversation makes us uncomfortable, but necessary for us to have. So the foods that you eat they should go through you, and for absorption, your body takes what it needs for energy, strength building, and all of that, and then expels. Essentially, that's why it's waste, because you're done with it, right? But then in order to expel it, are there certain positions that you should take to ensure that the expelling process is actually done in the right place? So you talk about foods that were introduced to us that were not traditional to us, and our parents and forefathers never had these bowel issues, really. So also the way in which excretion took place, and I'm talking about mechanisms now, actually sitting, squatting, whatever, have also changed. With the more comfortable toilet bowl, right? Has that obstructed the way in which folks essentially pass waste?
Yes and no.
Okay.
Because it all depends basically on the food you take, and of course on how your bowel functions. But yes, you're right. It is one of the key components to say evacuation of stool. So in other places, I think you've already answered. You put out a point and answered the question already. So I totally agree with you. So
what did I say?
So you don't remember what you say? Positions,
Okay.
times, if it is regular and so forth, and having the right environment. Of course, it's if you don't have the right environment, you may hold your stool for quite a while, okay, all right, but you have to have the right environment and of course the right posture. We know it helps with evacuation. It's not 100%, but I think the key issue is of course things like exercise and good nutrition or a balanced diet cover about 90% of.
You see, Daktari, I'll give you a story of my late brother, Bernard. So Bernard would say every time that he would go to a washroom, he always preferred using a latrine. And he used to say, I'm going to launch a missile. That was his statement. I remember him saying it vividly. And he would say that because he said it was easier and better for him because he felt as though he would empty everything easily as opposed to sitting on the modern day toilets. And one just asks the question, which one is best when it comes to evacuation or missile launching? Which one
So
is best?
it's not one size fits all. That is what I always say. So we're all different, but it's of course it is if you wish to spend and you find it is acceptable to not put effort into passing the stool. Sometimes using a latrine is better. Okay, all right. For those whose stool just comes out, they will not have any problems. So it's not one size fits better. But the usual physiological way is latrine posture because it helps. So that is why we have different types of toilets.
Yeah.
Yes.
Okay.
Yeah.
If Dennis Okari were here, he would have said that he has figured out the science that at every time, at a particular time in the day, that you can actually tune this thing down to a science, that if you eat certain foods at a certain time, that you can be sure that your bowel will be cleaned out. Is that the case?
Yeah, because it's bowel evacuation is about the brain sometimes. So if you're sometimes stressed, you may not, you may retain more. And if your stool is hard, you have to put in a lot of effort. Okay,
Literally.
yes. So and it's difficult to push. But again, there's the other side of the coin, whereby people go to the toilet and read a newspaper, sit and so forth.
You shouldn't do that.
Really, it's eventually when you're putting pressure for a long time, you end up with problems, hemorrhoids.
That's my next question. Because what are hemorrhoids and how do they form and how can you avoid them?
So hemorrhoids are just basically vessels around the anus and rectal opening, okay? And basically they are cushions, so they are internal and external. So basically what happens is that there's supposed to be blood flow. So when you have pressure around that area, it kind of blocks the blood flow. So you have pulling, you may get clotting of those vessels, pain, itching, and sometimes they become so big that they pop out. All right, and if they become if it clots or blood clots in them, you may have to seek medical help.
So there's a direct correlation between the
Yes.
food that you eat not being able to...
So especially constipation.
Okay.
Sometimes diarrhea, it may occur because you're pushing or something of the sort. So that is also a major issue. So it's a progressive problem. And of course, there are certain conditions where they may reoccur or occur. For example, in pregnant mothers, the incidence is very high because the uterus sits on the, may put pressure on some of the veins so that there's no backflow. But after the pregnancy is delivered, it's
released.
Yes.
So sometimes you have to have hemorrhoids cut out.
Yes, sometimes you have to have them removed, but that doesn't mean they cannot recur.
Okay.
Yeah.
Yes, because they are vessels, and sometimes a vessel may not be seen, but it may reappear if the pressure continues.
You see, actually, one of the latest things that people do most of the time is the gadgets that you have on a daily basis. I have a phone, I'm going inside, I was watching a movie, or I'm catching up with my people, I am attending class, or I'm having a meeting, because nowadays we do them on Zoom, and someone decides to go with their phone and just keep on staring while doing their business. And one would say that has, over the time, interfered with the quality of or how this business is being done. So just what is your thought process on the same? Because we've been introduced to a lot of new things that you're taking, but perhaps we don't know the damage that we're doing on ourselves. So what would that be?
I totally agree. It's just straightforward. We spend more time on the phone while we're eating. We spend more time on the phone while we're whatevering and so forth. So maybe it is a way of dissociating ourselves from the problems that we have or the environmental issues that we have. Once in a while, it's okay, but doing it often, then you kind of become an addict of.
I think this is interesting because before you had mentioned, Dr. that you can link poor bowel health to mental health, and that certain things that happen in your body then will affect the way you think and function. And we don't take it seriously enough, probably, to an extent. We put anything into our system and expect, look, see, the stomach is full and we're okay. But then now it leads us to two things: junk food and alcohol. Does alcohol then affect the health of the bowel and that system?
Okay, so which one can I start with? Junk food. So it's interesting that the human being can eat rats, cockroaches in time of famine. You saw when there was a war in South Sudan, what they were eating and so forth. So the body is highly resilient, but if there's too much of everything, it's bad. So what I just do advise, if you follow the rule of half the plate, vegetables and fruits, a quarter carbohydrate, a quarter protein, then you're good to go. And maybe 2 meals or 3 meals as you see fit. The thing about junk food, sometimes it's addictive. In terms of environment, in terms of situations, in terms of access, and sometimes it's also good to look at. And what happens is that we are being, we have these adverts that tell you about this. When you walk on the street, what do you see? Junk food. And they are so nice pictures. Immediately, it hits your eye, it goes to your brain. You think you need something and so forth. It's the easiest. And usually, for example, when I'm stressed and whatever, what do? I say, oh, there's junk.
Yeah.
Run for it. My solution. Then you say, but eventually the problems pile up. Okay. Alcohol. Is it legal? Yes, it is legal. How people fail to ban it? Yes. There's the Prohibition Act in the US in the 1920s. They had banned it. Even other countries have tried. There are states in India where they have tried to ban it, but they have failed. Do we know that it causes issues? Yes, it does. Okay. How does it cause issues? It's a recreational drug or product, of course, and it's cultural. So wherever I come from, if you go and visit people at home, you start with a pot of beer and so forth. Some people will start with maybe get wine after or before and so forth. So it's cultural, so it's kind of difficult. The problem comes in when there is misuse. Okay? And when you start having misuse, you start having problems because you'll have change in bowel habits, you may have liver injury, you may have pancreatitis and so forth. And also your mental state begins to misbehave and so forth. And sometimes it causes a disorder in the system. It affects the normal flora, gut flora. And so you have imbalance between the good and bad bacteria. So the bad bacteria tends to take over. And you know very well the good bacteria through the gut modulates your entire being. We have a number of diseases that if you modulate the gut, we have found that it improves. For example, if you have irritable bowel disease, there's some evidence there. Certain diarrheas, it helps and so forth. Certain, even severe liver injury due to alcoholic hepatitis. It has been found that certain bacteria do modulate. So people have taken advantage of this and come up with prebiotics, probiotics, but it's all about making money at the end of the day. You can do most of this by sticking to a healthy nutritional diet and modulating your lifestyle.
So, Dr. Harry, let's talk about something that is very common nowadays, and it's all about detox of the body. There is also the intermittent fasting that people undertake, and one would say one of the ways that has been working is blending things like spinach, drink that throughout the day. And many are saying, we can even say some of our viewers are saying it has worked for them. What would be your position on that, and how does that affect your bowel movement or just the quality of life that one enjoys?
You want my heretic thoughts? Yes, I would say crap. So the issue is, why do I say that? The key issue is what is your objective? Okay, is it to lose weight, or is it to take up a fad that everybody is doing? What are you trying to address? Okay, so you need to think about it from that perspective, and remember, it's not one size fits all. Yes, different people respond to different things. There's always a good, bad, and ugly of something. Okay, for example, you've talked about modifying foods. The good thing about it is that you're doing some activity, you're enjoying what you're doing, you've created something new, you drink it. So what if you modify your spinach, you think it's going to help you? It's helping your brain. You're happy about it. You're comfortable, and if you drink it, you're content. Okay, because if I gave you food that you didn't like, would you?
You wouldn't. Yeah.
You'd run away from it. Ugly side of it. You get fresh spinach, maybe grown in the wherever where the sewage is passing, and they are either hepatitis A or some bacteria or something, and you don't process your food properly, you end up with upset stomach. You may have to be admitted for it or something of the sort, and etc. Okay. The other issue is what happens that if you have one leaf that is toxic to your body and you blend it, you've mixed all the poison there. Probably you end up with liver damage or pancreatic damage or something of the sort. So those are the things that you think about. Then the issue of fasting.
Yeah.
Why
Intermittent or whatever the case may be.
So the question, people need to understand that our bodies are meant to keep energy. Okay? So our bodies are meant to limit the amount of nutrition. But what happens after intermittent fasting? Are you going to do it forever? So you keep on going up and down. So you probably lose 1 or 2 kilos. Okay? All right? I would say, is that water? Or is that the fat that you want to lose? But usually most of the time, if you do it for a long time, it is maybe possibly fat, but I think it's more of water. So, and that is not really encouraging, and it's not good for your health. You may affect your kidneys, you may affect so many stuff. Then washouts. So why are you doing washouts? Is it because you're constipated? Or it's because you want your bowel empty when it's empty?
Spring cleaning.
But could you not spring clean with healthy diet?
Okay.
Yeah. So why should you go and push a tube and then do a washout? You feel fine, and then the next time you may actually get addicted to it. That is, and if we have individuals who use laxatives, there's what we call laxative misuse disorder or laxative abuse disorder. So these individuals cannot function without laxatives. And then you're scratching your head on how you're going to reverse that. It's a very difficult problem, and you can get the laxatives over the counter. They may come as nutraceuticals because there are two businesses. There's the pharmaceuticals, which are the kind of approved medications. Then there are in between, which are the nutraceuticals, which everybody, even you can make and say sell on the whatever. But at the end of the day, what is the objective of the person who is selling it to you? Make money.
Indeed.
Yes.
So, Doc, I'm hearing you say that a lot of things that we do is based off bad information and the wrong information. And one would ask then, with all these that we like, it's good when you hear it, when you have testimonials from other people that it has worked for them, but it is the wrong information to consume, which makes the case for more education and proper information being shunned out there. But then again, how do we ensure that that happens? This is one of the ways, but then again, on a larger scale, how do we go about it?
So it goes back to the people. It can come from the doctor. The doctor can just help, or the specialists can help. The way things are going to change, in my opinion, is I think the people need to make a decision. We just throw it out there and say, make a decision. It's like alcohol. So if it so happens that you are allowing or collecting money because one is selling and consuming alcohol, why should I not have access to health care regarding the same? Yes. So if I have a problem, because not everybody will have a problem, people should be supported to work through that, okay? And I think one has to come up with groups, because leaving it to government or to the institution, it has failed. It's not going to go, because if I would ask you for your health, how often have you subscribed to? Yes, you subscribe to SHA, but how often have you used SHA?
Once.
Once. Yes. Are you entitled? Yes.
Yes.
And what have you done for an alternative? You have an alternative insurance, because see, this one will not take care of that. So primary health care is important. Education, starting at primary schools and going to secondary schools, those are things that I think are important. So if we can, churches, opportunities, like corporates, you come up together and say, have a cooking class, have a cooking competition, have this and that, can make a difference. Yes.
Yeah.
Okay. So what exactly, this irrigation thing, because just like you said, with irrigation and laxatives, it's used a lot by people. So, okay, I'm feeling a certain kind of way, flush it out, and then suddenly you see your skin start to glow, your hair starts to grow, your nails are stronger, all these things happen, you feel better, you have more energy. Is it a myth, or is it actually true? And then what happens during irrigation of the bowel?
So, it's kind of, I would say, something that has been ongoing since the times, since before independence, okay? So, but the problem is that everything has its good, bad, and the ugly. And if we look at the ugly side and the bad side and the indications for irrigation, I would stay away from it.
Okay.
Because when things go wrong, you could have bowel perforation, you could have introduction of you may use wrong water, okay? You may have, or whatever they're using for, whatever you usually use water, you can have water intoxication if you have kidney impairment and so forth. So yes, you may have a washout, but again, the other side is it washes out the good bacteria. So you're basically in a cycle of no return. So it's like either taking alcohol and misusing it, or when you have your exposed to, say, cocaine in a party for the first, it sparks off something and goes into a cycle. So I would strongly advise avoid that. Use other options, and I think those options work. But again, people, it's like alcohol. I can tell you not to drink, but if you decide to drink, there's nothing I'm going to do.
Yeah.
Yes. So Doc, let's look at, in terms of the bowel issues that we have here as a country. You as a practitioner, how do the numbers look like? Are there warning lights flashing that things are getting bad? Or are we heading there?
I think we have described, because you have already said it. We're getting there. We're getting there. It's already there. And we discussed earlier about the nutrition intake. And we also described about people's complaints. For example, we have more complaints about problems like constipation, young people. It's really a problem, hemorrhoids, etc. So I think it's there. Alcohol is also picking up, maybe because post-COVID, all right, and maybe because of the stresses of the economy or something, poor regulation. Misuse of antibiotics is also a major issue. We use antibiotics in everything, including growth of chicken and animals and so forth. So, and so forth. So and then we end up eating them. Then we say, okay, that's the big deal. So there's a lot, and Yeah, so I think it's a major issue, and I would tell you there are quite a number of individuals who say, I have this abdominal pain, I do not know what it is. And then you're subject to so many investigations. At the end of the day, you're spending a lot of money on that. But some patients really, if they want to curtail those signs and symptoms, they have to take medication. So it's kind of it opens a can of worms, and it's a conveyor belt of problems.
There's a question here that comes in terms of constipation in babies, and then how do you actually handle that? Because the babies, sadly, can't tell us how they're feeling, but you see that maybe the child. Well, they do tell us. They have a cry, so they can't speak it, but they'll tell you if there's something wrong. Plus, you'll see the signs that maybe they've not passed a stool. How often should they be, number one, passing stool at that age, babies, and then number two, how can you be sure that if it's an IBS issue or if it's a constipation issue?
Yeah, I would defer to babies because I stopped. I graduated to adult medicine and so forth. But the issue with, of course, you remember when you're born, this is my own theory. When you're born, your bowel flora is different from, say, 6 months down the road. So you're more likely to react to certain foods than others. Breast milk is better, and it's recommended because it's balanced. It has certain things. It has even, in my opinion, some probiotics that help the baby's gut function better. And how you breastfeed the baby also is important, because have you seen people who chew gum sometimes? What do? Sometimes they have to belch. Yes. So you're busy swallowing air. So if you don't know how to breastfeed properly or place the baby properly, the baby's busy swallowing air. Then when you swallow a lot of air, what happens? You get bloated. You have this colic. You have this, that, and then some of the formulations. You have seen what mothers do. They keep on trying this. Try that, that.
And everything that is suggested.
Yes, everything that is suggested and so forth. So I would defer to the pediatric doctors and say, hey, can you sort this one out? Come up with ideas. You should call a pediatrician and tell them, can you give us 1, 2, 3, which that works. Then what was the other question?
In terms of then, how do you tell her then what you do constipation in babies? So to know whether it's a more serious issue like IBS.
So if a baby persistently fails to thrive, and is persistently vomiting, and you think it is of concern, you need to see a healthcare practitioner to find out what is going on. Yeah, because I remember it's babies may not tell you directly that this is causing problems, but they'll tell you indirectly. So with experience, you'll be able to know. But if they're crying, the stool is hard, and they are failing to thrive for whatever reason, and the mother or the father cannot sleep, then you know that, hey, probably I need to see somebody just to make sure that nothing else is going on. And hopefully before the baby is born, the expectation is that the midwives and the OBGYN and team would educate the mothers and fathers on care of such babies, so that usually it is done, traditionally it's done through parents or aunties or something of the sort, but some of the information is good, some of it is incorrect.
It's incorrect. So does what the mother eats at the time of breastfeeding have a direct impact of what goes into the milk that then affects this baby's nutrition?
Yes, it does. It does. Yeah.
Okay.
So there's a question that has been asked here, real quick, Dr. Does drinking apple cider vinegar help with good bacteria in the gut?
Why would you drink for cider? So all of us want to lose weight, but the trick is those things don't work. Okay. So the answer is no. Forget about it. And really, everything done in small amounts is okay. But what my esteemed is trying to say is that I can use it for treatment of my ailment, which doesn't make sense. I don't know what the ailment is, and I don't think he would have to show me a clinical trial that proves. Otherwise, if it were, then would be making profits from apples
all over the world.
Yes.
Indeed. Look, has been most informative this morning, and some of the things that we don't talk about necessary for us to have done this morning. And you've been most insightful helping us with this conversation this morning. So thank you for coming in and doing this with us.
Thank you.
Dr. Christopher Opio is a gastroenterologist at the Aga Khan University Teaching Hospital. Has been our guest on Healthy Friday this morning. So you've learned one thing or two. It's great.
This is the Situation Room, the only way to start your day.